Hello, I'm Dr. Lonnie Herman here in South Florida, and I'm with a patient of ours. Her name is Jane. She is, I can say her age, she approved of that. She's 63 years old. She lives here in South Florida, which you're about, what, an hour south? Or
45 minutes away.
45 minutes away from the office. And Jane had started here. How many months have you been into our program?
Since May, which is how long?
So we're probably about 7 months in, 6 to 7 months into this program. This whole body, unique, drug-free, whole body Hashimoto's recovery, chronic fatigue recovery program that she entered here. And you were suffering with chronic fatigue, yes?
Yes.
And how many years had you suffered with chronic fatigue?
Off and on for like 15 years, but in the last few years, by noon I was gone. I was dead. I was tired.
There was energy in the morning, but then by noon it was forget
Right.
about it. And you were thinking that maybe in the morning it was better energy because of the thyroid medication you had to take in the morning, right?
Correct.
And you're on Armour thyroid?
Armour thyroid.
Okay. And how many years have you been on thyroid medication?
Probably 15.
15 years. And how recent was it that your doctor, your endocrinologist, told you that you had thyroid antibodies?
Back in May when I started looking for an alternative. Yeah.
Okay. So you already were on thyroid medication, but nobody was looking for thyroid antibodies until more recently.
Well, they did. Yeah. Nobody saw that until recently. So
Nobody
I
saw
don't.
that until recently.
Yeah.
So there was kind of a misdiagnosis actually, because she actually had an autoimmune thyroid disease instead of just a thyroid problem that Armour medication can help. You also had joint pain and muscle pain?
Lots of joint pain and muscle pain. Sometimes I felt 90 years old. Yeah.
Really? And you know, others may call this fibromyalgia. Nobody ever termed that for you. But when we look at chronic fatigue, did you also have a sleeping problem?
The reality is I never really talked to doctors too much about this.
Okay.
That is a reality.
Okay, so nobody was actually calling it that then because there weren't too many physicians involved. You're more of a natural,
Right.
trying to do homeopathic remedies for yourself because
Right.
you've already been into that for years.
Right.
But even being homeopathic for many years, there was not too much relief of the chronic fatigue and the joint pain and the muscle pain.
No.
You've gone to chiropractors?
Chiropractors, craniosacral massage,
Mm-hmm.
lots of things.
Okay. And
Which made me feel better, but then I'd have to go every week.
and
Couldn't get
how
that.
much, when you say made you feel better, you were having complete relief of the pain or of the fatigue or of what?
Well, I don't know if it got rid of the fatigue, but it just made me feel better in general.
Okay, and it would feel better for just the afternoon after that treatment or for the whole
Sometimes
week?
it only lasts 2 or 3 days.
Okay. Now, so coming in here, your fatigue was pretty severe all day.
Right.
And were you sleeping at night? Was it insomnia problem or was it?
I had insomnia. I took some supplements for that, but yeah, I've slept okay, but not great.
Not great, okay. And right now you'd say you feel how much improvement? You've given
Well,
a
thanks to
percent.
my doctor here, I feel about 80% better. I would
80%
say.
better. Now we still have a little bit more to do. There's still some
Right.
other dental procedure that has to be done. So we're not
Right.
done with the program yet, but we're here 6 months in and 80% better. And you'd say how many days a week are you feeling this improvement? Is it every day that you're feeling good? Are there any down days at this point right now?
Yeah, now and then. Now and then.
And how
But that's
now and then?
normally just because I have a lot in my life going on, you know.
Okay.
But no, like I had before, I don't have days like that anymore.
So there are no more fatigue days. You got to just
No.
go lay down at 12 and it's done for the day. Now you
No.
can garden. You can do different things now that you couldn't do before.
Right.
Right. And actually the supplement load that we had to start with you was a lot higher than it is now, isn't it?
Yes.
We were using a lot of different
a lot of
pills and
supplements
a
in
lot
the
of things had to
beginning.
start. And now it's much less because the body
Right.
doesn't need as much now.
Right.
Now we still have some other detox parts of the program that we have to go through, but you're almost done with, and she had to. She wanted to get better, so she was willing to invest in herself and do some other procedures that I recommended with the proper kind of dentist. And that really, you know, there were some infections that she never knew about that it took our skills to be able to determine that in the mouth. So there is a big difference there. So 80+% improvement, no more chronic fatigue. Not
No.
really. Not
No.
unless you're overexerting yourself and you're just
No,
like, I'm done.
really don't have that anymore.
No more chronic fatigue. So for all the chronic fatigue people out there, you can be done with that condition because it is not impossible. It's only impossible if you are trying to remedy yourself without knowing what to do. And it's only impossible if your physician doesn't know why it's happening, which they
Right.
commonly don't. So the pain in the body is
Yeah, as far as the aches and pains.
No more aches and pains.
No, I don't have that anymore.
No more. And you went hiking. You just told me you were on a trip and you went hiking.
I did go hiking.
So with what we just prescribed, the knee pain wasn't there, and you were able to hike up for a while.
Right.
You did pretty damn good.
I did pretty good.
Pretty good. Was there anything else that we missed that you want to comment or compliment about?
Well, I think what opened up my insight to this was that there's so much that goes on inside the body that we're so unaware of. And I think one thing positive about this treatment with you was the thorough exams, that the doctors don't give these kind of exams, that find all kinds of things that kind of bring the whole body back in tune with itself, I would say. Yeah.
And no drugs.
No drugs.
Very unique, yes?
No drugs. I didn't take any drugs.
And a very unique program here.
Right, right.
And one more thing that I just want to touch, that Jane actually, when we first started testing her and doing these physical kinesiology tests, on that first day or two, you didn't have any strength in your hands.
Right.
Wasn't that true? You couldn't hold, and what was it, just holding a book, or could you not hold like a dinner plate or a cup? Was that difficult?
Well, I couldn't hold a somewhat heavy book.
Couldn't hold the book.
It would fall out of my hands.
Yeah, so her hands were so weak, it was so hard for her hold to grasp certain things, and probably by the second week, that was gone.
That
right?
was gone, and that's permanently gone, yeah.
Permanently gone. So the strength in her hands is back, the pain in the body is gone, the pain in the joints is gone, the chronic fatigue is gone, and she feels 80+% better. So, and that's without drugs, and we just have a little bit more to do, and then she will be perfect, I believe.
I like
right?
that. Perfect.
All right, Jane, thank you so much for the help
you.
here. So we are always helping people with this very unique drug-free, whole body, integrative program here, and you can get well. You can. So, and here's proof with a person who I did not pay for a testimonial, and she is a real person with real conditions for many years who suffered and is not suffering anymore. So our phone number is 954-370-3100, and we look forward to helping you too. Thank you.